Yes, so good morning to all of you. So I was just waiting for this display to come. Yeah, so good morning to all of you. Dr. Pradeep Pawar here, Professor of Anatomy with a vast experience of teaching students, the undergraduates as well as the postgraduate entrances. Okay, so good morning to all of you. We begin with the MCQs for the FMGE students especially. Have a look at this. Starting with the first MCQ students for you. Come on. Venipuncture is done to obtain blood from the median cubital vein lying in the roof of cubital fossa. Perfect. All the following structures lie in the fossa except. So we're talking about cubital fossa. And all the structures lie in the cubital fossa except. Any guesses? Students. Be interactive. Answer this so it will be easy to understand and teach also. So what do you say? So all the following structures lie in the fossa except. Yes, the answer for this is ulnar nerve. Remember students, ulnar nerve is not a content of cubital fossa. Ulnar nerve is not a content. A very common mistake made by the students. Ulnar nerve is taken as a content of the cubital fossa. No, ulnar nerve is not a content. Okay, just to brief you about the contents of cubital fossa with a good slide. I'll draw this for you students, have a look. So this will give you an overall orientation. Yo, I start. Tell me, that's the first rib here, huh? Your first rib hai. That's the first rib. If you can tell me students, what is this artery which is crossing the first rib? The artery, yes, if you can answer this. What is this artery? That's a subclavian artery. And this subclavian artery, the moment it crosses the first rib, it is now known as what? Anyone? Can you answer this? The subclavian artery, once it crosses the first rib, it then becomes what? The axillary artery. Axillary artery. And students, for your reference, I'm telling you this axillary artery, if I draw a muscle here, what is this muscle behind which the axillary artery goes, or the axillary artery goes behind this muscle? In other words, this muscle is going to divide the axillary artery into three parts. It divides the axillary artery into three parts, and once the axillary artery crosses this muscle, what is this muscle? Just a diagrammatic representation. This muscle is the teres major. The moment the axillary artery crosses the teres major, it becomes what now? Brachial artery. A very important option in the MCQ for you. The axillary artery continues as the brachial artery at the lower border of teres major. Is this clear? So at the lower border of teres major, the axillary artery would become the brachial artery. Now this is the pectoralis minor muscle. And the pectoralis minor is going to divide the axillary artery into three parts. That's the first part. Behind the muscle ke piche second part, and that's the third part of the axillary artery. Perfect. Is this clear, students? So first part of the axillary artery is from the outer part of the first rib to the muscle. Second part is behind the muscle, and the third part is after the muscle till the teres minor. After this, the axillary artery continues as what? The brachial artery. Perfect. Now you tell me, what is this that I'm drawing for you? What is this, students? If you can quickly tell me. This is the lateral cord, that's the medial cord, and ye artery ke piche kaun hoga? What's that? Posterior cord of the brachial plexus. So these are the cords of the brachial plexus, and the cords are placed according to their names in which part of the axillary artery? The second part. So that's the second part of axillary artery. This is the lateral cord, this is the medial cord, and ye hoga posterior cord. Now this is one nerve, a branch of lateral cord. This is a branch of lateral cord. These are the branches of medial cord. This is a branch of medial cord. And tell me now, what is this going to be? What is this nerve, students? This is the median nerve. Ye hoga median nerve. So what is this? This is the lateral root of median nerve. Ye lateral root of median nerve hai. This is going to be the medial root of median nerve. Medial root of median nerve. Okay, so the lateral root of median nerve is a branch of lateral cord. The medial root of median nerve is a branch of medial cord. Both these roots will join to form the median nerve. following the students. Can anyone tell me the root value of median nerve? Another very important MCQ for you students. कोई बोल सकता है root value of median nerve? उसके लिए you have to know the root value of lateral cord. Can you tell me the root value of lateral cord? Anyone? You can guess, bachon. You can guess, so it will be easy for you. What is the root value of lateral cord? C5, C6, C7. Root value of lateral cord. Medial cord क्या है? C8, T1. C8 and T1. So lateral cord का कौन सा root है ये? What is this root of the lateral cord? That's the lateral root of median nerve. And this is the medial root of median nerve. So median nerve का root value is going to be C5 to T1. All the roots, सारे roots होंगे median nerve में, because median nerve is formed by the lateral root and the medial root. So the median nerve is formed. Tell me, where is the median nerve formed with respect to the axillary artery? Another very important MCQ, students. The median nerve is formed lateral to the third part of axillary artery. I hope you are understanding. The median nerve is lateral to the third part because this nerve, that's the medial root of median nerve, crosses the axillary artery. Now this median nerve, look, this median nerve, I'm telling you how the structures come in the cubital fossa. This is very important. Now this median nerve is going to cross the brachial artery. ये देखो, this median nerve is going to cross the brachial artery and come on which aspect? The medial aspect. So now when we see this cubital fossa, students, जब आप ये cubital fossa देखते हो, if you can tell me now, what is this muscle जिसके दो heads है? What are these two heads of pronator teres? What is this? The brachioradialis, and that's the imaginary line. Imaginary line. So the median nerve passes between the two heads of pronator teres and gets out. The brachial artery is now going to divide into, yes anyone, the brachial artery is now going to divide into a radial artery and an ulnar artery. Radial and ulnar artery, if you can tell me, that's the head of the radius, that's the neck of the radius, and that's the radial tuberosity. What is this muscle inserted on the radial tuberosity? Students, this muscle inserted on the radial tuberosity is the biceps brachii, biceps. And the last nerve comes here on the lateral side. What is this? The radial nerve. Radial nerve. Radial nerve comes from behind and then comes in the cubital fossa. So students, this becomes the contents of the cubital fossa. This has to be perfect. Okay, this is extremely important for you. Contents of cubital fossa, I'll just label this for you. That's the radial nerve. Radial nerve. That's the tendon of biceps brachii. This is going to be the brachial artery. Brachial artery, and that's the medial nerve. Okay. I've told you how the contents come in the cubital fossa, if you have understood that. ये pronator teres है, ये brachioradius, and that's the imaginary line. I hope things are clear. So once again, just to recapitulate the boundaries of cubital fossa. Medially, pronator teres. Laterally is the brachioradialis. The base is formed by the imaginary line joining the two epicondyles. The contents of cubital fossa from medial to lateral. One is the medial nerve. Second is the brachial artery, with its two terminal branches, the radial and ulnar. The tendon of biceps, and finally the radial nerve. Radial nerve. I'll just take an opportunity to tell you the floor of the cubital fossa also, students. Floor. See, this is very important, and see how nice it is to understand this. Okay, एक floor भी बोल देता हूँ आपको. So this is the head of the radius, that's the neck of the radius, that's a radial tuberosity. And ये है ulna. Like the radius has got a tuberosity, the ulna also has got a tuberosity. What is this tuberosity known as? Ulnar tuberosity. And what is the muscle inserted on the ulnar tuberosity? The muscle inserted on the ulnar tuberosity is, what is this muscle? Brachialis. Brachialis. And what is this muscle which begins from the ulna? Bachcho, this muscle begins from the ulna, goes behind the radius and gets inserted on the radius. This muscle begins from the ulna, goes behind the radius and gets inserted on the radius. This is what we call as the supinator. So floor of the cubital fossa is formed by what? Brachialis and supinator. This is a very important MCQ. That's the floor of cubital fossa. Clear, students? So floor of cubital fossa is formed by the brachialis and the supinator. Boundaries I've told you, the contents I've told you, and how the structure comes in the cubital fossa I've told you. Perfect. Does ulnar nerve lie in the cubital fossa? No. No. Ulnar nerve is not a content of cubital fossa. Right. Which is the vein which lies in the roof of cubital fossa? That's the median cubital vein. Median cubital vein, ये roof में होती है, roof of cubital fossa. Perfect. I'll clear this. Have a look. Answer this now once again. So answer is ulnar nerve. Brachial artery, yes. Medial nerve, yes. Radial nerve, yes. What else is the content of cubital fossa? क्या बाकी है इसमें? The tendon of biceps. Tendon of biceps. Ulnar nerve is not a content. Just remember this. Going to the next MCQ. Look at this slide once. एक बार ये slide देख लो and just try to tell me what is this nerve, students? What is this nerve? Look at this. What is this nerve? That's a median nerve. That's a median nerve. This is the cubital fossa. So that's a median nerve. That's a brachial artery, but it's two terminal branches. That's a radial. That's a ulnar artery. This is the tendon of biceps, which is cut here, and that's a radial nerve. So this becomes the contents of cubital fossa. I hope this is clear. Come on, come to the next MCQ. Students, if you can answer this. A 40-year-old male comes to the clinic with history of cough and fever. On radiological examination, the tuberculosis with pleural effusion of the right lung was noted. During pleural tapping, the needle is inserted in the intercostal space along the upper border of the lower rib. Yes, exactly. Where do you insert the needle? If you have got two ribs, the upper rib and the lower rib, the needle is always inserted on the upper border of the lower rib. Upper border of the lower rib. I hope you are understanding this. This is the upper rib and that's the lower rib. ये है upper border, lower border. The lower border has got a groove like this. इसका नाम क्या? What is this groove known as? Costal groove. Costal groove. And what are the structures present in the costal groove? That is vein, artery, nerve. Structures present in the costal groove is the vein, artery, nerve. So when we put a needle to remove the fluid for pleural effusion, the needle is always put along the upper border of the lower rib. Upper border of the lower rib to prevent injury to the nerve. Nerve नहीं होती यहाँ पे. So the arrangement of neurovascular structures in the intercostal space is vein, artery, nerve. Vein, artery, nerve. It's the intercostal vein, then it's the artery, and finally you get the nerve. Vein, artery, nerve. ये normal sequence है. Students, this sequence is reversed in which rib? Can anyone tell me? The normal sequence in an intercostal space is vein, artery, nerve, and this sequence is reversed in which rib? First rib. First rib में nerve, artery, vein होता है. Nerve, artery, vein. Yes, Anshana, very good. So normal sequence is vein, artery, nerve. In first rib it is reversed. It is nerve, artery, vein. First rib. And if you can tell me, children, these muscles, these nerves and vessels are lying between two muscles. Which is this muscle? This is the external intercostal. This is the internal intercostal. And this is the innermost intercostal. Innermost intercostal. So, where do these nerves and vessels lie? Can anyone answer this? The nerves and the vessels lie between which two muscles? Between which two muscles of the ribs? They lie between the internal and the innermost intercostal. यहाँ पे. They lie between the internal and the innermost intercostal. The nerves and the vessels. Internal and the innermost intercostal. Perfect. Coming to the next MCQ. Answer this. A student developed tingling and numbness in the hand. On examination, the physician diagnosed it as compression of a structure passing deep to the flexor retinaculum. Which of the following structures passes deep to the flexor retinaculum? Yes, students, answer this. These are very important MCQs, very important MCQs for you. Which of the following structures pass deep to the flexor retinaculum? Any guesses? You can guess. That's a median nerve. Answer for this is median nerve. Yes, the median nerve is going to pass deep to the flexor retinaculum, below the flexor retinaculum. Rest everyone will go above the flexor retinaculum. Okay, I'll just draw a slide of flexor retinaculum. Students, see if you can understand this. Be interactive, students. Be interactive. Tell me. Okay. Median nerve. Shri, very good. So I'll just quickly draw this flexor retinaculum for you. That's the flexor. These are the carpal bones, and the carpal bones are placed concavely. Bachon, carpal bones are like this. They're not placed in a straight line. They're placed like this in the form of concavity. Scaphoid, lunate, triquetral, pisiform, and trapezium, trapezoid, capitetamid. And if this is medial and this is lateral, tell me who's this which is covering the two ends of the bones together. This is the flexor retinaculum, and this flexor retinaculum splits here. यहाँ पर divide हो जाता है ना, flexor retinaculum divides here. It divides here. Tell me what passes to the slip of the flexor retinaculum. Bachcho, these are extremely important MCQs. What I'm telling you, huh? If you can tell me what is this tendon of which passes through the flexor retinaculum, through the two slips of the flexor retinaculum. What is this tendon? Yes, this is the tendon of flexor carpi radialis. Flexor carpi radialis. This one which passes through the carpal tunnel, this is the tendon of flexor pollicis longus. These are the four tendons of flexor digitorum superficialis. These are the four tendons of flexor digitorum profundus. The tendon of flexor pollicis longus is put in a bursa, and the flexor digitorum superficialis and profundus are put in a bursa. Can anyone tell me what is this bursa known as? This is the radial bursa. समझ में आ रहे बच्चों ये? See what happens, you know, when we move the wrist, there's going to be a friction. There's going to be a friction of this tendons. So to prevent the friction, there has to be something. Otherwise, this tendons will undergo wear and tear. So there has to be something. There is a synovial sheath which is going to enclose this tendons here. And the synovial sheath which encloses the tendon of flexor pollicis longus is known as radial bursa. So radial bursa with the flexor pollicis longus. You're perfect, and you have to be very clear about this. And what is, oh, I'm so sorry. So sorry. That is gone. Once again I'll draw that for you. Stop. Sorry. See, these are the carpal bones. Once again. So that's a flexor retinaculum, and the flexor retinaculum splits here. If that's lateral and this is medial, it divides here. What is the tendon which passes through the flexor retinaculum? That's the tendon of flexor carpi radialis. This is the tendon of flexor pollicis longus. These are the four tendons of flexor digitorum superficialis. These are the four tendons of flexor digitorum profundus. Okay. Now students, what is going to enclose this tendon? That is the radial bursa. And what is going to enclose this tendon? That's the ulnar bursa. Ulnar bursa. Very good. Ulnar nerve does not pass through the flexor retinaculum. Yes, bacha, yes, I'm drawing that for you. I'm drawing that. Just one moment. This is the flexor. This is the radial bursa. Radial bursa with flexor pollicis longus. This is the ulnar bursa. I'm drawing this. Just one moment. Give me some time. With flexor digitorum superficialis and flexor digitorum profundus. Correct? And now students, what is this nerve here? Which is this nerve which is passing through the carpal tunnel? इसे क्या बोलते हैं? Carpal tunnel. Between the flexor retinaculum and the carpal bones. What is this tunnel here? The carpal tunnel. Carpal tunnel, right? So what are the structures which are passing through the carpal tunnel? You should know this. One is the flexor pollicis longus with radial bursa. This is the flexor digitorum superficialis and profundus with ulnar bursa. And between the flexor retinaculum and this tendon, you get a nerve here. Now students, when there's an inflammation of this ulnar bursa, when the ulnar bursa gets inflamed, this medial nerve gets compressed between the flexor retinaculum and the ulnar bursa, and this compression of the medial nerve in the carpal tunnel is known as carpal tunnel syndrome. That's carpal tunnel syndrome. So that's medial nerve. Now students, जैसे ये flexor retinaculum divides on the lateral side. If you get an MCQ, the structure which passes through the flexor retinaculum, the tendon which passes through the flexor retinaculum, your answer is going to be flexor carpi radialis. Now, जैसे flexor retinaculum lateral side पे divide होता है, similarly the flexor retinaculum sends a small extension on the medial side. It gives a small extension on the medial side, and this is what we call as the volar carpal ligament. This is what we call as the volar carpal ligament. And between the volar carpal ligament and the flexor retinaculum, this is what we call as the Guyon's tunnel. Guyon's tunnel. Barabar. So Guyon's tunnel is between the volar carpal ligament and the flexor retinaculum. Students, between the volar carpal ligament and the flexor retinaculum. And what passes through this Guyon's tunnel is the ulnar nerve and ulnar artery. Ulnar nerve and ulnar artery. What goes above the flexor retinaculum? This is the tendon of palmaris longus. The tendon of palmaris longus. Then there is a nerve here. There is a nerve here, and there is an artery here. Artery. This is what you have to know. Okay, what are these nerves and what are these arteries? I'll just put numbers here. Okay. So what is number one? Number one is ulnar nerve and artery. This you have to know. ये बहुत बार MCQs आते हैं. Number two which I've written is the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. Number 3 is palmaris longus. Palmaris longus. Number 4 is palmar cutaneous branch of medial nerve. Palmar cutaneous branch of medial nerve. And the 5th is superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Students, you should be perfect with this. Perfect. So what are the structures which go above the flexor retinaculum? One is the ulnar nerve and vessel. Second is the palmar cutaneous branch of ulnar nerve. And what is this nerve going to supply? The skin over the hypothenar eminence. Yes, skin over the hypothenar eminence. The third one is the tendon of palmaris longus. The fourth is the palmar cutaneous branch of median nerve, which supplies the skin over the thenar eminence. And the last one is the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Are you clear? Any doubts? Yes, Shri? Anjana, any doubts? Is this perfect? Okay, fine. I'll tell you that. So coming to the next MCQ now. Tell me this. Which of the following muscle covers both the elbow and the shoulder joints? Yes, all of you, I'm asking in general. Any doubts किसी को होंगे तो you just ask me. So which of the following muscles covers both elbow and shoulder joints? Yes, be interactive, students. The rest of you also be interactive, so it is easy. Which of the following muscle covers both elbow and shoulder joint? The short head of biceps brachii, the coracobrachialis, the long head of triceps, and the brachialis. Yes, what do you say? क्या बोलते हो? Which of the following muscle covers both the elbow and shoulder joint? Any guesses? Bolo, come on, students, answer. Any guesses? C. Okay, very good, Anjana, very good. Any other answer for this? Any other answer? Again, this is a very important thing that you have to know. So there are two correct answers in this. Sometimes you get an MCQ like this, but sometimes you get an MCQ in which might not be right, which might be wrong. You get the benefit of doubt, no doubt about it, but you should be confident about your answer. Yes, Asamul, very good. Asamul, that's coracobrachialis. You are saying coracobrachialis. Short head of biceps. Ek answer C hai. There's one more answer in this MCQ. Can anyone tell me? It has to act on both elbow and shoulder joints. Students, dekho, ek minute, just listen. To act on the shoulder joint, if a muscle has to act on the shoulder joint, it has to cross the joint. Barabar, it has to cross the joint. Matlab, it should be arising from which bone? Matlab, it has to arise from the scapula. If a muscle has to act on the shoulder joint, it has to originate from the scapula. It has to cross the shoulder joint. Only then is it going to act on the shoulder joint. Perfect. Yes. If a muscle has to act on the elbow joint, it has to cross the elbow joint. Matlab, the muscle has to be inserted in the bones of the forearm. The muscle has to be inserted into the bones of the forearm. Radius and ulna. Abhi bolo. That's a hint. Yes, the short head of biceps brachii The short head. One answer is short head of biceps brachii. The short head is also correct because the short head of biceps brachii arises from coracoid process. It arises from the coracoid process of scapula. Matlab it is crossing the shoulder joint. And both the heads of biceps are inserted on what? The radial tuberosity. It is inserted on the radial tuberosity. I'll draw a slide. Make slide draw karta hu. See if you can understand this. See if you can understand the slide. One moment. What is this? What is this aspect of the scapula? कोई बोल सकता है? ये कहाँ से देख रहे हो? Where are you looking this from? See, learn to draw such slides, students. ऐसे अगर slides draw करते हो ना, तो it becomes very easy to understand. See, this is the radius. That's a ulna. This is the ulnar tuberosity. That's a radial tuberosity. I just told you there's something inserted on the ulnar tuberosity. There's something inserted on the ulnar tuberosity. That's a brachialis. I've just told you. There's someone inserted on the radial tuberosity. That's the biceps. Another very important MCQ. So ऐसे discuss करते करते ना बहुत MCQs cover होते हैं students. You should have just an open vision. Just keep your minds open. There are so many things that you come to know when we're discussing the MCQs. So ये कौन है? Radial tuberosity. Structure attached to the radial tuberosity is the biceps brachii. Biceps brachii. Yes, very good. Very good. It is always a revision. The more you answer, that is why I always tell you, be interactive, bachcho, be interactive. The more you are interactive now, so I come to know what you are answering, and accordingly we can go into depth of the subjects. Wait, I'm telling you, just wait. So what is inserted on the radial tuberosity, bachcho? Radial tuberosity is the biceps brachii, on the ulnar tuberosity is the brachialis. Perfect. Now if you can tell me, what is this muscle? What is this muscle which begins from the humerus? Students, ये जो muscle है ना, it begins from the humerus and it is inserted on the ulnar tuberosity. ये क्या हो सकता है? What is this muscle? That's the brachialis. So very interesting line diagram. See, brachialis का origin is what? Brachialis arises from the humerus, lower half of the humerus. Where is the brachialis inserted on the ulnar tuberosity? Tell me, which joint is the brachialis going to act on? Looking at the slide, which joint is the brachialis going to act on? Will it act on the shoulder joint? No. It will not act on the shoulder joint because वो shoulder को cross ही नहीं करता है. It doesn't cross the shoulder at all. So it will be acting only on the elbow joint. It is in front. It's in front of the elbow. So what is it going to do to the elbow? Flexion. It will do flexion at the elbow joint. Now what is this muscle? Can anyone tell me this muscle which begins from the coracoid process and gets inserted on the humerus? What is this muscle? Can anyone tell me? Flexion of the elbow, yes. Which is this muscle which gets originating from the coracoid process, inserts on the humerus? What is this? This is the coracobrachialis. That's the coracobrachialis. Tell me, bachcho, is the coracobrachialis going to act on the elbow joint? No, definitely no. Because coracobrachialis is not going to cross the elbow joint. It will act only on shoulder joint. Coracobrachialis will act only on the shoulder joint. See now, if you can tell me this. What is this muscle? Dekho. What is this muscle which begins from the coracoid process? This is the second muscle which begins from the coracoid process. And there's another head of this muscle which begins from the supraglenoid tubercle. What is this muscle? ये क्या muscle होगा? And I'm reflecting this muscle. इसे ना थोड़ा सा side पे लेके आ रहा हूँ मैं. I'm reflecting this muscle and this muscle is inserted on the radial tuberosity. This muscle is inserted on the radial tuberosity. Tell me, what do you think is this muscle? What is this head? That's a long head. And what is this head? Short head. Long head and short head of biceps brachii. This is the biceps brachii. Perfect. Yes, very good, Anjana. Very good. So this is the long head of biceps brachii which arises from the scapula. and दूसरा है short head of biceps brachii. Both the heads of biceps brachii are inserted on the radial tuberosity. Both the heads of biceps are inserted on the radial tuberosity. Tell me students, the biceps brachii is going to cross two joints. The biceps is going to cross two joints. One is the shoulder joint and one is the elbow joint. Would the biceps not act on two joints therefore? Yes, it is going to act on the elbow joint. Yes, it is going to act on the shoulder joint. So one is biceps brachii. One is biceps brachii. Perfect, perfect. Bacho, perfect. Be very clear about your concepts. Huh? Concept should be clear. And I'll make you another slide for you. Look, I'll make another slide for you. If you can tell me, what is this aspect? ये क्या aspect है scapula का? ये पीछे से देख रहा हूँ. This is the dorsal aspect of the scapula. Dorsal aspect. What is this muscle which begins from the infraglenoid tubercle? This muscle, which begins from the infraglenoid tubercle. That's a long head of triceps. Long head of triceps. What is this muscle which begins above the spiral groove? Above the spiral groove. That's the medial head of triceps. Medial head of triceps. And what is this entire muscle which begins from the spiral groove and the shaft? What is this? Sorry. 8 minute. This is the lateral head. This is the medial head of triceps. Medial head. That's the lateral head of triceps. That's a long head of triceps. And this triceps is inserted on what? This entire triceps is inserted on the olecranon process. Olecranon process. This entire triceps is inserted on the olecranon process. Okay, students, अब समझ में आ रही है? Can you understand this? Now you tell me all these three heads together. All these three heads. एक long head है, एक short head है, एक long head है, एक medial head है, एक lateral head है. See, this is very easy slide that I've drawn for you. So you tell me the long head of triceps begins from where? It begins from the scapula, the infraglenoid tubercle. Yes. The lateral head begins from the humerus, above the spiral groove. The medial head begins from the humerus, below the spiral groove. And all these three heads are inserted on olecranon process. Now you tell me, this triceps will act on which joint? ये तीनों heads है ना, long head, medial head, lateral head. They will act together on which joint? They will act on the elbow joint, students. They are going to act on the elbow joint. And what is this triceps going to cause? Extension at the elbow joint. It will cause extension at the elbow joint. Which head out of these three is going to act on the shoulder joint? Which head out of these three is going to act on the shoulder joint? Anyone? Answer. Out of this three heads, कौन सा head है जो shoulder joint पे act करेगा? The long head. The long head of triceps will act on the shoulder joint. The lateral and the medial head are not going to act on the shoulder joint because they do not cross the shoulder. They do not cross the shoulder. So they are not going to act on the shoulder joint? Yes, perfect. Ab clear hai bachcho? So the muscles which are acting both on the shoulder and the elbow joint would be, in this case, the long head of triceps and the biceps. Perfect. I've drawn a very easy slide for you bachcho. I hope you have understood everything. And see, look, I've drawn the slide, so I feel I should be telling you this. This is beautiful. You tell me this. Listen. Which is the nerve of this compartment, bacha? Which is the nerve of this compartment? Nerve of the anterior compartment of the arm. Can anyone tell me which is the nerve of the anterior compartment of the arm? Students, you should know this. Which is the nerve of the anterior compartment of the arm? Guess. You can guess. That's the musculocutaneous nerve. Musculocutaneous. I hope this concept is clear. The nerve of the anterior compartment of the arm is the musculocutaneous. Axillary nahi hai, it's the musculocutaneous nerve. And the musculocutaneous nerve is going to pierce this muscle. Can anyone tell me, bacha, what is this musculocutaneous nerve going to pierce? What is this muscle? Sorry, oh, that is gone. The slide is gone. The musculocutaneous nerve is going to pierce which muscle? Can anyone tell me? The musculocutaneous nerve is going to pierce which muscle? The coracobrachialis. It pierces the coracobrachialis. The musculocutaneous nerve lies between two muscles here, between the biceps and the between the biceps and the brachialis. मतलब look, this is so nice. The musculocutaneous nerve क्या pierce करेगा? Coracobrachialis. अब it will lie between two muscles, between the biceps and the brachialis. Biceps and the brachialis. So if I have to see the musculocutaneous nerve, what do? I just reflect the biceps. I just reflect the biceps, and what do I find? The musculocutaneous nerve lying on brachialis. Lying on the brachialis. So what is the musculocutaneous nerve going to supply? The coracobrachialis, the brachialis, and the biceps. Perfect. Be very clear, huh? ये concepts हैं बच्चों, concepts clear होना चाहिए. Once the concepts are clear, no, everything is easy then. Answer this, students. Radial nerve पीछे है बच्चा. Radial nerve is back side. Inferior parathyroids develop from which of the following pouches? Can anyone tell me? Children, answer. Inferior parathyroids develop from which of the following pouches? A very important MCQ, very important. बोल सकते हो? Yes, fine. Inferior parathyroid develops from which of the pouches? Inferior develops from third. Yes, inferior develops from the third. And the superior develops from the fourth. Inferior develops from third and the superior parathyroid develops from the fourth. Second से क्या बनता है? Can anyone tell me second से क्या बनता है? Look, the first pouch divides into a dorsal and a ventral part. The first pouch divides into a dorsal and ventral part. Dorsal से बनेगा tubotympanic recess. Tubotympanic recess से दो चीजें बनती हैं. One becomes the eustachian tube and the other one is the middle ear cavity. So tubotympanic recess. So dorsal, first pouch divides into a dorsal and a ventral part. When the dorsal forms the tubotympanic recess, and the tubotympanic recess forms two things. One is the eustachian tube and the other one is the middle ear cavity. The ventral joins with the second to form palatine tonsil. Ventral joins with the second to form the palatine tonsil. What happens to the second endodermal pouch? The second joins with the ventral part of the first. Joins with the ventral part of the first to form the palatine tonsil. Same way. Second endodermal pouch joins with the ventral part of the first to form the palatine tonsil. Okay, no? Now what happens to the third? The third endodermal pouch divides into a dorsal and a ventral part. Dorsal and ventral part. What is the ventral form? Thymus. A very important MCQ, bachcho, very, very important MCQ. Thymus is derived from what? Thymus is derived from the ventral part of the third endodermal pouch. Ventral part of the third. And dorsal se बनता है inferior parathyroids. Dorsal se बनता है inferior parathyroids. Fourth endodermal pouch divides again into a dorsal and a ventral part. Dorsal and ventral part. Dorsal से बनेगा superior parathyroids. Superior parathyroids. And ventral forms the ultimo branchial body. Ultimobranchial body. And this ultimobranchial body is going to form what? It is going to form the parafollicular C cells of thyroid. Parafollicular C cells of thyroid. Is this perfectly clear to all of you? So the third endodermal pouch divides into a dorsal and ventral part. The ventral forms the thymus. Thymus. Very important. Thymus is derived from what? Thymus is derived from the ventral part of the third endodermal pouch. Very important, students. Thymus is therefore formed where? Neck. Thymus is formed in the neck. The thymus then descends down into the thorax, into the mediastinum. That's the ventral part. Dorsal part se kya banta hai? That's the inferior parathyroid. Fourth pouch forms what? The superior parathyroid, and it forms a body which is known as the ultimobranchial body, and this ultimobranchial body is going to form what? The parafollicular C cells of thyroid. But students, recently it has been shown that the parafollicular C cells are derived from the neural crest cells. Recently it has been shown that the parafollicular C cells are derived from the neural crest cells. Agar MCQ aata hai, parafollicular C cells of thyroid are derived from, your first answer is going to be the neural crest cells. Agar option mein nahi hai, if it is not in the option, you take it as ultimobranchial body. This should be perfect. Very good. Chalo, we'll go to the next MCQ. I hope this is clear to all of you. Have a look at this. A 60-year-old patient meets with a fracture of the neck of the fibula. Which of the following muscles would be paralyzed? Neck of the fibula. Which of the following muscles would be paralyzed? One moment, I'll put this MCQ later for you. You answer this. Answer this first. Thoda sa na usme correction hai. Okay, answer this, students. In fetal life, the umbilicus contains 2 umbilical arteries and 1 umbilical vein. Function of umbilical vein is 2. Anyone? Answer this. Umbilical vein. Umbilical vein. Any guesses? Carries oxygenated blood towards the fetus. Very good. So what are the contents of umbilical cord? Can anyone tell me what are the contents of umbilical cord? I'll just draw this for you. You may draw it now. This is another very important MCQ for you, bachcho. Very, very important MCQ. Chalo, we'll make it like this. Tell me, what are the contents of umbilical cord? Anyone? What are the contents of umbilical cord? There are 2 umbilical arteries and 1 umbilical vein. Now this umbilical vein goes and joins with what? Ye maine liver banaya. This I made as the liver, and this is something in the liver that I'm drawing for you. What is this? That's the portal vein. Ye hai portal vein. That's the portal vein. And there's a big vein coming from the liver. What is this? That's a IVC. Here I begin for you, students, the fetal circulation, a very important topic for you. So the contents of umbilical cord are 2 umbilical arteries and the left umbilical vein, because the left is left. 2 arteries and the left umbilical vein. Now this left umbilical vein will begin from where? Placenta. It will begin from the placenta. And it will go and join with what? The left umbilical vein goes and joins with the left branch of portal vein. The left umbilical vein goes and joins with the left branch of portal vein. Students, it goes and joins with the left branch of portal vein. Tell me, left umbilical vein is coming from where? Placenta. It is carrying pure blood. Agar ye portal vein mein gaya, if it goes and joins with the portal vein, from the portal vein, the blood would go to the liver. All the pure blood will go to the liver. The liver is so happy. The liver will use all this pure blood for its own metabolism, and no pure blood will go further. Understanding? If this pure blood from the umbilical vein goes to the portal vein say ye liver mein gaya, the liver will use all this pure blood for itself, for its own metabolism. So the entire blood should not go to the liver, students. There is a bypass. There is a bypass from the left branch of portal vein to the IVC. From the left branch of portal vein to the IVC is a bypass, and this is what we call as the ductus. venosus. Ductus venosus. So what does the ductus venosus connect? The ductus venosus is going to connect the left branch of portal vein to the IVC. From the IVC, the blood now comes to what? From the IVC, the blood now comes to the right atrium. ये right atrium में आ गया. Right atrium से the blood directly goes to the left atrium through foramen ovale. Foramen ovale है ना fetal circulation. So the right atrium say the blood goes to the left atrium through the foramen ovale. Left atrium say the blood goes to the left ventricle. Left ventricle say it goes to the aorta. Aorta divides into two common iliacs. Common iliacs divides into an external iliac, internal iliac, internal and external. And from the internal iliac, these are the two arteries going up towards the umbilicus. From the internal iliac, there are two arteries which are going up towards the umbilicus. As they're going towards the umbilicus, on the way comes the urinary bladder. On the way comes the bladder. Students, the two umbilical arteries begins from the internal iliac. They begin from the internal iliac, and where are the internal iliacs? Pelvis. They are in the pelvis. So from the pelvis, the internal iliac begins and goes up towards the umbilicus. They begin from the internal iliac and they go up towards the umbilicus. As they're going up towards the umbilicus, they go on either sides of the bladder. They go on either side. So एक यहाँ से जाता है, एक यहाँ से जाता है. Both the arteries goes on either sides of the bladder to the umbilicus. Perfect. Now just one last thing here. Suppose from the right atrium, अगर blood right ventricle में गया, right atrium से अगर blood right ventricle में गया, right ventricle से the blood will go to the pulmonary trunk. The blood will go to the pulmonary trunk, and from the pulmonary trunk the blood would go to the lungs. From the pulmonary trunk the blood would go to the lungs, but the lungs are not functioning. Students, the lungs are not functioning. So the blood is bypassed to the aorta. From the pulmonary trunks, the blood goes to the aorta, and this is what we call as the ductus arteriosus. Ductus arteriosus. So from the pulmonary trunk, the blood again goes to the aorta, and this is what we call as the ductus arteriosus. Clear hai bachcho? This is what we call as the fetal circulation. This is what we call as the fetal circulation. Fine, perfect. See, once again, I'll quickly tell you, your fetal circulation is very important. Fetal circulation is very important. So what are the contents of umbilical cord? There are two umbilical arteries and the left umbilical vein. The left is left. Just remember it like this. There are two arteries and the left umbilical vein. The left is left. Okay, there are two umbilical arteries and the left umbilical vein. The left umbilical vein goes and joins with the left branch of portal vein. The left umbilical vein goes and joins with the left branch of portal vein. It carries pure blood. If the blood goes in the portal vein, it will go to the liver. The liver will use all this pure blood for its own metabolism. So the blood should not go to the liver. The blood is therefore bypassed from the left branch of portal vein to the IVC through ductus venosus. You get an MCQ. Ductus venosus connects what? It connects the left branch of portal vein to the IVC. The ductus venosus connects the left branch of portal vein to the IVC. From the IVC, the blood goes to right atrium. Right atrium is the left atrium through the foramen ovale, left ventricle, aorta, common iliacs, internal iliacs. From the internal iliacs, the two umbilical arteries, they come up, they go up towards the umbilicus. From the umbilical artery, the blood goes towards the umbilicus. Perfect. Okay. Right. Suppose from the right atrium, if the blood goes to the right ventricle is a pulmonary trunk, and from the pulmonary trunk, the blood goes to the lungs. But the lungs are not functioning in fetal life, so there's no use. The blood directly goes to the aorta through the ductus arteriosus. But if you can just tell me what happens after birth. These are extremely important MCQs. What happens after birth? After birth, this is gone. Tell me, what is this? This is the obliterated left umbilical vein. What do you call this as? Obliterated left umbilical vein is now known as the ligamentum teres. Obliterated left umbilical vein. After birth, this left umbilical vein obliterates. This is what we call as the ligamentum teres. Perfect. Ductus venosus का क्या बनता है? I have to write it here. Obliterated left umbilical vein. obliterated left umbilical vein is ligamentum teres. Ligamentum teres. Okay, I'll tell you this. The ductus venosus after birth becomes what? The ligamentum venosum. Ligamentum venosum. Foramen ovale का क्या बनता है? Foramen ovale becomes the fossa ovalis. Fossa ovalis. Ductus arteriosus becomes what? The ductus arteriosus becomes the ligamentum arteriosum. Ductus arteriosus becomes the ligamentum arteriosum, students, and this part of the umbilical artery from the bladder to the umbilicus. Look at this. Look at this. From the bladder to the umbilicus obliterates off. The part of the umbilical artery from the urinary bladder to the umbilicus, this part will obliterate off. This is what we call as the obliterated umbilical artery. This is now known as the medial umbilical ligament. अभी इसे आप बोलोगे medial umbilical ligament. Okay, so that is the obliterated umbilical artery that becomes a medial umbilical ligament, and this artery extends from the internal iliac to the bladder. This artery represents the non-obliterated part of umbilical artery. The non-obliterated part of umbilical artery extends from the internal iliac to the bladder. It is now known as the superior vesical artery. Superior vesical artery. Clear? So superior vesical artery is the non-obliterated part of umbilical artery. Non-obliterated part of umbilical artery. Okay, I'll just write this down quickly for you. ये diagram clear है ना? Okay. Look at this. I'll just write this down for you. This is very important MCQ. So, obliterated left umbilical vein. Obliterated left umbilical vein is ligamentum teres. Ductus venosus is ligamentum venosum. Yes, thank you. Ductus venosus is ligamentum venosum. फिर foramen ovale. Foramen ovale is fossa. I'm writing fast thoda. Fossa ovalis. This is beautiful. Anatomy is very interesting, students. You should just understand the concepts. You understand the concepts, you will enjoy them. You will enjoy them. Foramen ovale is fossa ovalis. Ductus arteriosus is ligamentum arteriosum. Next, obliterated umbilical artery. Obliterated umbilical artery is medial. ये बहुत इंपॉर्टेंट है. Medial umbilical ligament. Medial umbilical ligament and the non-obliterated part of umbilical artery. This becomes the superior vesical artery. The non-obliterated part of umbilical artery becomes the superior vesical artery. Superior vesical artery. This is perfectly clear to all of you. Perfect. Perfect. Any doubts anyone has, you please ask him. Any doubts anyone has, you please ask them. Obliterated left umbilical vein is ligamentum teres. Ductus venosus becomes the ligamentum venosum. Foramen ovale becomes the fossa ovalis. Ductus arteriosus becomes the ligamentum arteriosum. Obliterated umbilical artery is the medial umbilical ligament, and the non-obliterated part of umbilical artery is the superior vesical artery. Superior vesical artery. Okay, very good, very good, very good. Very good. Can anyone tell me what is median umbilical ligament? Median umbilical ligament. Bacha, just tell me what is median umbilical. This is medial umbilical ligament. And a medial umbilical do hote hain. There are two medial umbilical ligaments. You tell me what is median umbilical ligament. Anyone? Answer bacho. Answer. What is median umbilical ligament? Anyone? देखो चिल्ड्रन, इन फीटल लाइफ ये यूरिनरी ब्लैडर है ना, इन फीटल लाइफ दिस यूरिनरी ब्लैडर इज कनेक्टेड टू द अम्बिलिकस. इन फीटल लाइफ दिस यूरिनरी ब्लैडर इज कम्युनिकेटिंग विद द अम्बिलिकस थ्रू, दिस इज व्हाट वी कॉल एज द urachus. In fetal life, the urinary bladder communicates with the umbilicus through urachus or allantois. इसका नाम है urachus और this is also known as allantois. So in fetal life, there's a communication between the urinary bladder and the umbilicus. This is what we call as the urachus or allantois. After birth, this connection is gone. In us, now there is a ligament. There is a ligament which extends from the apex of the bladder to the umbilicus. Yes. This is what we call as the median umbilical ligament. Median, M-E-D-I-A-N. Median umbilical ligament. So median umbilical ligament is the obliterated urachus. Yes, obliterated urachus or allantois. If this does not obliterate, students, अगर ये obliterate नहीं हुआ, the child will be passing urine through the umbilicus, and this is what we call as a weeping umbilicus, or a urinary fistula. Weeping umbilicus or a urinary fistula. Okay. So what is a weeping umbilicus? It is due to persistence of urachus or allantois. This is perfect. Okay. This is very important. Okay, fine. Students, now one moment. I'll just come back to this. One moment. Before we proceed, just have a look. Sorry. Before we proceed, just have a look at this. Just one moment. Yeah. So, students, the NEET PG calendar for you. These are free tests. Do give this test. This is 26th. Yeah. This is 26th. You've got an at 4 p.m. today. You've got an image-based test series, mixed bag 4. 27th. That is tomorrow. You've got an all-India mock test. Students, we have got an all-India mock test for PG 2022, March 27th, 9 a.m. Remember the date, 9 a.m. March 27th. It's the NEET PG 2022 All India mock test. Do give this exam. So we have launched a previous year question banks. You can avail the benefit of this. We are now launching the first prof. Because the colleges have started, the first year students have come. We are launching the first prof for the students. Doubt clarification series, something new, and it's really very useful for the Plus platform. April 6th onwards with the top educators, the doubt clarification series specially for you. Students, we have got a Plus subscription in which there are daily live classes, live quizzes, learning from the top educator, access from the device of your choice, and now you can also access our question bank. An iconic subscription where you get the best of Unacademy and pre-platter. Right? Some special class features in which there are daily live classes, live quizzes, poll for the learners. Never miss the class with proper notifications being given. And if you miss it, you get the lecture notes in the form of PDF. So anywhere, anytime you can get your doubts solved, access your class. So these are the FMG toppers. We've got very good ranks in the recently, in the last held NEET, FMG exams in the month of December. Okay, so we're starting with new batch, NEET PG 2022 High Yield Theory Revision batch. Students, it's from March 30, 1.5 months. A quick revision batch just before the exams, just before the NEET. FMG 2022 High Yield Revision and MCQ batch for 2 months beginning from March 30. Download the Unacademy app and subscribe to it. You can have a look at this on the website, the Plus subscription, the iconic, and now we come with a light subscription for you. Students, I hope you've understood everything. And if there's any doubt, do ask. So we'll be coming with such similar lectures, a series of lectures for you all. Be there. Thank you for a very, very interactive session. Thank you to all of you. Thank you. It was a very interactive session. You be interactive, so it becomes very easy and very interesting to teach, to learn. Thank you. Thank you to all of you. Thank you, dear children. Thank you, and see you again. Thank you. I'll stop here.